and you're all very welcome to this month's training on BlueEye Clinic. So sit back and relax, and Sean and myself will take you through it. I'm going to present a few slides first, and then my colleague Sean DC will continue on to do a demo. So I'm Jan Caffrey, business development and marketing for RedZinc, and Sean is business development manager in RedZinc. And we're going to go through how to reduce spread of virus, which is a very important part of using telehealth, as well as some environmental benefits. And then Sean will demo how to log in, make test calls, make scheduled calls and instantaneous calls. And then we'll show you the calendar, how to manage your appointments and any upcoming features that we have. So without further ado, we'll talk about how telehealth helps reduce the spread of viruses. There's a very sensible list here on the left. It limits physical contact. Obviously, people aren't coming in and waiting in a waiting room and picking up viruses that are in the air around. You can do a lot remotely. You can do a lot of triage and asking questions and early intervention, giving advice over video, sending on leaflets or instructions on how to manage. So yeah, this reduces the burden on staff in hospitals, which are always looking to reduce that burden. You can follow up and monitor patients, and we'll talk more about that later. It's possible to get your prescription renewed now at the chemist directly. And you can educate people using remote telemedicine very easily. So there are a lot of advantages, including you can be anywhere at any time to do it. So we're going to talk about BlueEye Clinic. It's like having your own virtual clinic online. It transcends geography. It reduces waiting time. Patient can be in the comfort of their own home. As we said, it eliminates risk of contagion, and it contributes to carbon offsetting. So we have discovered that each consultation saves 4 kilograms or 13 bathtubs of carbon dioxide. So BlueEye Clinic, we're very proud. It's secure and easy to use. The patient privacy is GDPR compliant. The servers are local servers, they're dedicated, and there's no transfer of information to China or the States. It's all, within Ireland. The patient doesn't need to do anything really apart from click on the link that you send them. You can have 30 participants. You can do all your normal features, which Sean will show you. And then we have analytics, which is available to people in IT or people who manage the clinics. There's 3 types of calls you can do, video calls you can do. You can do an instantaneous one. You can schedule a call for sometime in the future. And you can also have a dedicated URL link for patients to drop in, use the link and drop into your waiting room. Sean will show you that. If you want to get in touch with ourselves at support@blueye.video, or you can get in touch with Sean directly. That's his email address there. Or you can contact your own digital health regional manager in the HSE or Anne Scanlon in the HSE. So I'm going to hand over to Sean now, and he is going to show you all of those little bits that I talked about on the actual product itself. So over to you, Sean.
Thanks, Jan, and you're all very welcome. I'm just going to share my screen now. Okay. Yes, okie dokie, here we are. Nice. So when you log into your BlueEye account, you just go to hse.blueye.video, put in your email and password, and this is the home page you come to. And what we tell all our users to do first when they log in each morning is to do a test call. And that's just to ensure that your camera is working, your microphone is working, your internet is giving you good enough connection to do video calls. And there's a couple of different ways you can do that. So the best and easiest way I go through the BlueEye platform is on the left-hand sidebar here, where you can access pretty much anything. And as you can see, there's a test call button there. And you can just do it at the top of the page from there either, whichever you prefer. I'm going to go into it now and briefly show you what that looks like. And you'll see an image of yourself as you would see it, and then an image of yourself as the patient would see it. And if both of those are in looking good, then you're ready to go really. And you can also do a speed test to check your internet connection. So I'll just quickly go in and show you those two now. Okay, you can see both videos working fine. That's great. And then you go in and do a speed test. Download it checks your download and upload speed. Just make sure your internet connection is good. Click on Start Test, and that'll tell you what sort of connection you have, whether it's excellent, very good, or potentially needs to be looked at. So once you've done that and you're ready to go, you can go back to the home page by using the left-hand sidebar here and click on the BlueEye logo, and that brings you back to the front. So as John mentioned, there's three different types of calls, which I'm going to take you through today. There's direct, which is instantaneous call, and you just put in the patient name, their number and or email, and you can jump straight into a call there. It doesn't need to be scheduled. Then within clinic, you can schedule calls for any time, and then you can manage appointments, and I'll show you all that in a moment. And then we also have a clinic link, which is a static waiting room link that you can send to your patient, and they can then join your waiting room at any time. So we'll start with the direct instantaneous call, and I'm just trying to invite Jan into a call, and I'll take you through some of the features once you're in a call. So you can put in, I'm just going to put in Jan's number, but you can put in their email and or their phone number, whichever you prefer. You can add as many participants as you like, up to 30, including yourself. To do that, just click on add participants. If you don't want to add anyone, just click on the red minus there. So once you're ready to go, you just click on call, and that'll bring you straight through to the call. I'll just mute myself. Now, you got to allow a minute or two for the patient to join. They'll have to click on the link, and then they'll have to give access to the camera and microphone. So that can take a couple of minutes. There we have Jan now. Thank you, Jan. Just the video. Oh, wait, there we go. Video coming through now. So once the patient's joined the call, you're ready to go. And I'm just going to take you through some of the features. So at the bottom here, as you can see, we have quite a few different features. Now, the first one, the red mute button, you can mute or unmute yourself at any time. Video, you can turn on or off your video at any time. And we've got the settings section here. And this is, you can change your audio capture or your video capture. You can add a blurred background if you wish, or you can add a virtual background. We have a couple of template HSE ones here. And you can stick that on, and that'll change your background or blur it for you if you wish. And beside that, we have refresh video. So if your video does freeze because your internet drops for a minute or whatever, if you click on refresh video, that'll get it up and running again. And beside that, we have chat at the bottom. So you can just write in your message, whatever it is, say hi, Jan. And then you can also pick whether you send it to everyone or just one person. So if you're in a multi-party call, let's say there's 3 or 4, You can send individual chat messages or you can send them to everyone in the call. So once you're ready, you just click on the Jan, click send, and it's ready to go. So after that, we have share screen. If you'd like to share your screen with the patient, just click on share screen. And then you can pick your Chrome tab, a window, or indeed your entire screen, whichever you prefer. Once you're ready to go, just click on share. Now, when you do that, the page will move up to the top right. To bring them back down, just click on the image like so, and that brings them back down beside you like that. Now we also have a participant section here where you can manage all the participants, particularly handy if you have more than 2 or 3 in the call. So you can add a participant from here. Just click on add participant, put in their name, number, and or email, and click invite, which same way as it would work outside the call. You can mute everyone from here, and you can also pass screen share control, remove participant, and unfocus, which will send them up to the top right-hand corner. And then you can mute everyone in the call from here as well. So there's 3 dots down the bottom. We have a couple more features to bring through. So here we have file transfer. We support all types of files, so you can transfer a file to the patient, whichever type of file you want. You just click on file transfer, choose your file, and again, like the chat, you can send it to Jan or you can send it to everyone in the call. So if you're in a 3 or 4 person call, you can send it to each person individually, or you can send it to them all at the same time. And once you've clicked and chose your file, just click on send, and that will send it over to them. Now you can also transfer a call. So I'll show you in a minute, but you can, if you're part of more than one clinic. So let's say you have your own personal clinic here, and then you're also part of a respiratory clinic or outpatient clinic, whatever clinic it might be. You can transfer the patient from your own personal clinic to that clinic in the transfer call button here. We also have a whiteboard feature as well, if you need that while you're in the consultation with the patient. And you can also record the consultation should you wish. And we have a place and wait room, which I'll show you in a moment. Now, on the patient side, as you can see, we have a few functions here at the top above the patient. You can mute or unmute the patient at any time. You can swap the camera for the patient as well. So it can be quite handy if you're if the patient's in a room with a loved one and they'd like to talk to you, or if they've got an injury on their foot, or whatever the case may be, and you'd like to access the other side of their camera. Now, obviously, it'll only work if the patient's on a smartphone, but it is a very useful tool indeed. Now, you can pass screen share control, which I mentioned briefly there a minute ago, and that allows the patient to share their screen with you also. And then finally, we can minimize the patient. So that just sends them up to the top right, as I showed you before. And to bring them back down, just click on the patient image. So thank you very much, Jan, for playing patient. I'm just going to show you now. I'll place Jan back in the waiting room, and we'll move on to clinic calls.
Thanks, Sean.
Right, so once you've placed them in the waiting room, you'll automatically be brought to the clinic section if you want to access it. Otherwise, you just click on clinic on the left-hand sidebar. And from here, you can do new points, which I'll show you in a moment. But for now, I'm just going to jump into view clinic. So there you can see Jan is there in the waiting room. And as you can see, that's a direct call, and it says much in the top in red. So that is what happens when you place them in the waiting room. So if you need to take a break for a minute, or you need a second opinion or whatever, place them in the waiting room, and then you can restart the call very, very easily by just clicking end your call. So I'm going to end that call now, and that's everything to do with the direct instantaneous call. And now we're going to show you Clinic Link. So Clinic Link is the second type of call you can make with a patient. And that's when you send a static link to the patient, and then they can access your waiting room here at any time. So I've shared it with my colleague Lavit. He has my clinic link and he can join my waiting room at any time. And when he does, this is what you'll see. Now, to share that link, there's a couple of different ways. You can copy it to the clipboard and add it to your letter or your email or however you currently communicate with the patient. Or you can do it through the BlueEye system, very simply by putting in their mobile number and or their email and clicking share. And once you've done that, the patient will get a text or an email, and then they can join your waiting room at any time. And once they do, as I said, this is how what it'll come up as. When you see them in the waiting room, you can also send them a message where you could say, I'll be with you in 5 minutes, whatever you like, and click send. And the patient will then receive that while they're in the waiting room. They'll know exactly what the story is. Now, once you're ready to jump into a call, I'll jump into it very quickly. All the functionality is the same. Not much really to show. So I'll just jump into the call quickly, show you it works the exact same way as the direct call. Just click on enter call, you hop into the call. Again, give the patient a minute or two to give the computer permissions for their audio and camera. And then, as I mentioned, all the functionality is the same as it were in the other call, all through here. So you can share your screen, you can do the chat, you can do the transfer call, etc., etc. And once you're done, you can just click on end call. There, once you click on end call, we give you three options. End call. You can leave the call, which leaves it open. So perhaps if you have a colleague on the consultation as well, they can continue the call and it just lets you leave. But for now, we're going to end it. And we'll go back into clinic using the left-hand sidebar here. View clinic. There you can see you have a list. Anybody who's in your waiting room will be inactive, or if you're in a call, anything upcoming, so any scheduled calls for later in the day will show here, and then anything that you've already completed. So that's how you do the static link with your patient. And the third and final way to make a call is by scheduling one. And there's a couple of different ways you can do that. I'm going to do it from here. Just click on new appointment at the top right. Pick the time and date. So I'll pick today and I'll pick 4:20, and then I'll just add myself. Easy. There we go. Same as before, you can add as many participants as you like, up to 30. You can also there's a couple of advanced call options here. So you can turn on or off text chat, you can turn on or off file transfer, you can force mute and call entry so the patient will join muted. And then you can also set a pre-call reminder for 24 hours or 48 hours. Now, obviously, this appointment is for today, so I'm not going to do that. Once you're ready, just click Create Appointment, and then it'll bring you to this page, and you'll have appointment created. And just show you then, you go in, and you can see there, I have an upcoming appointment at 4:20, which I just made. Now, back on the left-hand sidebar, you can manage all these appointments in the calendar section here. There you go. You go into your calendar and you can see all the different appointments you have, both past and future, if you have any. Don't. We'll go into the appointments for today. Click on that. There you can see everything you've done. So we finished call we just had with Jan, the call we just had with Lalit, and then the scheduled one. I'm just going to go into the schedule call here. Just click on view on the right there. And here you can use full management of the appointment here. So you can reschedule it. You can reschedule it for tomorrow, for instance. There you go. You get a green notification at the top saying appointment reschedule. You can add participants, same way as before, and as many as you like, up to 30. Let's do that now. You can cancel the appointment, and then you can also export the appointment. So if you click on that, hit that, and that'll connect, bring you through to your own personal calendar also. So that's how you manage appointments. You can export all your appointments to your own personal calendar by clicking here. But that's the 3 different types of call that you can make on BlueEye. So again, direct, the static waiting room link, excuse me, that a patient can access any time, and then the scheduled calls as well. Now, I'm just going to go back to the home page. Next thing we have here is the profile section. So once you've set up your account and you're ready to go, just make sure all your details are in here, your name, your specialty, etc., and all your security details. You can turn on 2FA, and the thing we're working on now as well, you can also add offline notifications for patient arrival. So if you've sent out the static waiting room link and the patient joins your waiting room, you can get a notification of that as well. And once you're happy with all that, just click on Save Preferences, and you'll get a green notification at the top to say user profile updated. Now, we do have plenty of help and support in the BlueEye platform. To access all the help section, you just click on the left-hand sidebar here. And here you'll have a quick troubleshooting checklist. You'll have a quick start guide, which will help you if you're just started. That'll give you all the basics to get you up and running and get started. If you want to go into more detail, you can download a user manual, a full user manual here. And then below that, we have a lot of different FAQs from some of our users, which should answer any questions or queries that you might have. Now, if you still have a question or query or need a bit of advice, we have a support section here on the bottom left. Just click on support. And here you can, whatever issue type it might be, video, audio, patient invitation, or anything else, just click on that, write in whatever the message is, and then click send support requests. And that'll go straight through to our support team. And we'll get quick turnaround time. We'll get back to you as soon as we can, usually well within 24 hours. Now we also have a feedback section below that on the left-hand sidebar. We're always delighted to hear from our users. If you've got any thoughts on something that we can add, a feature request or something we could improve, click it here, type in your message, and then just click on send feedback. And the same way as support, that'll go straight through to our support team, and we'll take a look at it and get working on it as soon as we can. So that's the BlueEye platform. And the last thing we do is make sure you log out when you're finished your session, especially if you're using a shared computer or you're in a shared workspace. So to do that, just bottom left of the sidebar here, log out, and then you're done. Now, I'm just going to show you a quick video on the patient process, how they join the BlueEye call, and then I'll hand it back over to Jen.
After a clinician schedules a call with you, the patient, you will receive a notification by SMS and/or email with the appointment details. You will receive another SMS or email 5 minutes before the appointment time, which contains the secure link for the call. You need to click on the link and allow the browser to access your camera and microphone to join the waiting room. The clinician is notified when you join the waiting room, and the video call is established when they join you in the waiting room. The email invitations in BlueEye Clinic have ICS calendar file which you can use to add the appointment to your calendar. If you have any questions, please contact us at support@blueye.video. Thank you.
Okay, thank you all for joining. I'm going to hand back over to Jan. We'll go through a couple more slides and I think the Q&A at the end. Thanks all.
Right, let me just share my screen again. So you've just seen the, am I showing the right display there?
Swap displays. Yeah.
That better? So you've seen the patient call joining process, and you can get a lot more information from our website at this URL, redzing.net. For our articles, or our YouTube channel also has a lot of different videos you can watch. So the features you have seen, Sean has touched on, are new ones. We have new user types: clinic manager and system administrator. They can do different things. The clinic manager can schedule calls without necessarily having to be on calls, but they can go into a call. System administrator can do things like set up a new account or look at the usage of BlueEye amongst the whole kind of organization. The waiting rooms you've seen, the shared clinic ones and the personal ones. But then we've different features that we've added, like virtual background options, group consultations, transferring patients between waiting rooms, sending messages to patients, and whiteboarding. There are 4 different types of user. There's the patient, the clinician, which Sean has mostly focused the demo on, the clinic manager, which I've just mentioned, can manage clinics and put up appointments and access the calendar. And then the administrator, as I was saying, can look at analytics and view the dashboard, but also can access appointments and calendars. So you've seen the 2 types of waiting room, personal and shared. And then I also just wanted to mention that we have enhanced services all around video. We've got remote monitoring. We call it a green box of sensors. I'll show you that in a minute. That allows us to do virtual wards. We have connected paramedic, where a paramedic has access to these mini wearable sensors and also this mini wearable camera. So that really helps them to send video to a call center or to a hot desk and sensor data directly from the patient, which is via Bluetooth and then via the wireless network, the public wireless network. So that allows for all sorts of new clinical pathways. It allows care for people at home, for people on the move, for people in remote areas, and also all different sorts of patient cohorts. We have our sensors in what's called a green box, and the starter kit has an ECG monitor, temperature monitor, oxygen monitor, and a blood pressure cuff. We also supply a smartphone with the BlueEye Care app that the patient can view their own data coming through on the sensors. And that allows us to set up a virtual ward with the sensors, with the Care app on the phone, which the patient has, and then that all gets, that patient data all gets transferred to a virtual ward, and they can have video calls as well, scheduled or ad hoc. If you want to know any more about the virtual ward, you can get a demo from us, so email us to express your interest. And then back to BlueEye Clinic, we are an award-winning video consultation platform, and it's in lots of different departments throughout the HSE and other healthcare providers. We're always very open to feedback. We love hearing from you. You saw there, Sean showed you how to put the feedback in, but you're always welcome to email us as well. And there's lots of support and resources out there. For users. You have your dedicated support desk. You've also got on our website a support portal for the HSE, which you can get to here. You'll see the button on the website. You've got your YouTube explainer videos, and the HSE also have instructions on the HSE website. So we have a training session the last Tuesday of each month. We can have a second training webinar, or if you have a large department wanting to use it, we can come in and show you how to do it. And then we have a newsletter a few times a year to tell you about training and new features and any other company information. So there's a summary. BlueEye Clinic is secure, easy to use. It has very reliable connection. We have local servers keeping the data secure. And we also have enhanced video services, as I mentioned. So that's it. We'll turn to the Q&A part of the webinar now, and maybe we can just turn off the recording to do that.